So many people will come into the Bascom Palmer Eye Institute looking for a second or even a third opinion. They may come in and say that they were told that they have a cataract and that they should have cataract surgery. And they come in and tell me, I'm doing fine. I don't feel like I have any problems with my vision. So we like to tell patients that even though they may have an early cataract, that doesn't necessarily mean that they need cataract surgery. And when the time comes that they are having a lot of symptoms, we refer them to a cataract surgeon who can help them with their problem. One of the most common complaints in ophthalmology is patients who complain about tearing all the time. And we tell them that they may have something called dry eye. And a lot of my patients question how they can have dry eye if their eyes are tearing all the time. And the answer is because the patient's eyes are so dry, they experience a reflex tearing. So even though their eyes are dry, they are tearing, and that is to compensate for the dryness of their ocular surface. The tearing stops when we treat their dry eyes. Just because a patient has a high intraocular pressure doesn't necessarily mean that they have glaucoma. Some patients have high pressure and they don't have glaucoma. Conversely, some patients have normal pressure and they do wind up having glaucoma. So it's up to us to assess each individual patient with their risk factors and their eye exam and follow them for some time sometimes to determine whether or not they truly have glaucoma or if they just have a high pressure in their eyes. I can't tell you the amount of patients over the age of 40 who come in complaining that they have to wear reading glasses. And many of them assume that they come into the Bascom Palmer Eye Institute and we can fix that with laser. So they ask me if they can have laser so that they don't ever have to wear reading glasses again. And sadly, the answer to that question is usually no. There are rare cases where patients can have laser on one eye for reading and leave the other eye to use for distance. But in most cases, LASIK is not for patients who need reading glasses.